So good day everyone, we are the group 3 and we are going to tackle about hearing impairment disorder. So by this, we are going to tackle the topics such as its impact, the pros and cons in school, and in the community, together with its cause, what are the types of hearing impairment, with its cure and remediation and resolutions in schools and the community. We're also going to tackle about the supported details and the law in the Philippines and globally, together with what should the teachers do in order to address this situation, or what actions should the teachers, the staff, and the school should make. By this, we are going to define what is hearing impairment disorder. So, hearing impairment disorder refers to a partial or total inability to hear in one or both ears. It ranges from mild hearing loss to profound deafness. It can affect a person's ability to communicate, learn, and engage in life. So, by this, hearing impairment affects one of our senses, which is our auditory or the hearing. So, if our hearing is affected, this can also affect our daily routines or our daily lives, such as communication, engaging with people, and the such. And by this, if our hearing is affected, it also affects our speech and communication. So, what could be the signs that we are in this situation, or we are currently facing hearing impairment? So, as what I have said, it ranges from mild hearing loss to profound deafness. So it starts with small, not so we do not really notice that much yet because it's still small. It ranges from mild up until, if we neglect it and if we don't pay attention to it, it goes profound until it really affects our hearing. So we must pay attention to this so that we can take action and find remedy as soon as possible. And basically that's it. And next is we are going to talk all about the causes of hearing impairment disorder.
First, let's talk about the causes. There are two causes, which is congenital causes and acquired causes. Under congenital causes is genetic factor. Hereditary hearing loss can be passed down through genes. Number 2, intrauterine infections during birth, such as rubella or cytomegalovirus or CMV. Third is birth complications, lack of oxygen at birth or birth aphasia, severe jaundice or hyperbilirubinemia, and low birth weight. Second is acquired causes. Under acquired causes is age-related hearing loss or presbycusis, gradual hearing loss due to the natural aging. 2 is noise-induced hearing loss, prolonged exposure to loud noises like at work, music, or explosion. Third is ear infection, chronic middle ear infection or otitis media, or outer ear infection is otitis externa. Fourth is earwax buildup or cerumen impactions. Excessive earwax can block the ear canal. Next is ototoxic medication. Certain drugs can damage the inner ear. Next is head injury or trauma to the ear, physical damage to the ear or head. Next is the chronic diseases, condition like diabetes, high blood pressure, and cardiovascular disease. Next is Meniere's disease, an inner ear disorder that can cause hearing loss, tinnitus, and vertigo. Next is otosclerosis, abnormal bone growth in the middle ear that can impede the sound transmission. Next is tumors, growth in the ear canal, middle ear, or on the auditory nerve. Example, acoustic neuroma. Next is sudden sensory neural hearing loss, rapid and explained hearing loss that often requires immediate medical attention. Infections, meningitis, measles, mumps, and other infections. Autoimmune inner ear disease, a condition where the body system attacks the inner ear. Physical obstructions, foreign objects in the ear canal. Eardrum rupture can be caused by infection, pressure change, or injury. Now, let's talk about the kinds of hearing loss. The first one is conductive hearing loss. This type occurs when sound waves are unable to pass through the outer or middle ear to the inner ear. Causes include earwax buildup, fluid in the middle ear, often due to infection, middle ear infections, otitis media, perforated eardrum, problems with the small bones, ossicles in the middle ear, foreign objects in the ear canal, and abnormal bone growth. Number 2 is sensorineural hearing loss. This type results from damage to the inner ear or the auditory nerve that transmits sound signals to the brain. Causes include aging, noise exposure, genetic factors, ototoxic medication, infection, head injury, Meniere's disease, acoustic neuroma, and sudden sensorineural hearing loss. Number 3 is mixed hearing loss. This type involves a combination of both conductive and sensorineural hearing loss. For example, a person might have age-related sensorineural hearing loss and also develop a middle ear infection, conductive or conductive hearing loss. In some classifications, a fourth type is also recognized: auditory neuropathy spectrum disorder, or ANSD. In this condition, sound enters the ear normally, but the inner ear or the auditory nerve is damaged, impairing the transmission of the signals from the inner ear to the brain. The degree of hearing loss can be also categorized as mild, moderate, severe, and profound. Additionally, hearing loss can be unilateral, affecting one ear, or bilateral, affecting both ears, and can be described by its onset, sudden or gradual, and progression, stable or progressive.
In community, there are 4 impacts. First is barrier to communication and employment. Second is limited access to services or social interaction. Third is higher risk mental health issues. Fourth is marginalization or discrimination. First is barrier to communication and employment. Trouble hearing and speaking can make it harder to get a job or interact with others. Second is limited access to services or social interaction. Some services or events may not be accessible or welcoming, causing of isolation. Third is higher risk of mental health issues. Loneliness or frustration can increase the chance of depression or anxiety. Fourth is marginalization or discrimination. People may judge or treat them unfairly because they communicate differently. First is language difficulties, especially in language-based subjects. Hearing loss makes it hard to understand spoken language, which affects reading, writing, and communication in class. Second is delayed speech and language development. Children may start speaking later or have trouble forming words and sentences clearly. Third is low academic performance due to missing instruction. If they can hear the teacher well, they may miss important instructions and fall behind in lessons. Fourth is social isolation or bullying. Difficulty communicating may lead to being left out or teased by the classmates, and because of that, it can also lead to low self esteem, which is our fifth impact. Low self esteem, struggles in learning, and making friends can cause feelings of failure or low confidence. First is can excel academically and socially with inclusive education. With the right support like sign language, interpreters, or special teaching strategies, through these things, they can do very well in school and with friends. Second is strengthened visual, tactile, and memory skills. They often develop sharper abilities, insights, touch, and remembering things to help them learn and communicate. Third is may develop strong nonverbal communication, may become skilled at using facial expressions, body language, and gestures to express themselves. Fourth is technology aids such as hearing aids or cochlear implants help integration. These devices improve hearing and make it easier to participate in their daily life. First is language delays. Not getting early support can make it harder to learn how to speak and understand language. Second is misunderstood behavior. They might be seen as rude, distracted, or uncooperative when they simply did not hear or understand or hear any sounds. Third is unemployment or underemployment. Without accommodations, finding or keeping a job becomes more difficult for them. Fourth is safety risk. For example, not hearing alarms. They might not hear any or emergency sounds like alarms, which can be dangerous for them.
And now we are going to discuss the cure and remediation in terms of hearing impairment disorder. So first we have the medical interventions, which is surgery. And under the surgery, we have cochlear implants, which means a surgically implanted electronic device that provides a sense of sound to individuals with severe to profound sensorineural hearing loss. It is the bypass damaged parts of the ear and directly stimulates the auditory nerve. So that could be one of the medical interventions under surgery. And then we also have the tympanoplast, which means a surgical procedure used to reconstruct a perforated eardrum or the small bones of the middle ear. So it is typically performed to restore hearing loss and caused by chronic ear infections or trauma. So basically, under surgery of the medical interventions, this tackles about reviving or bringing back their hearing. Then we also have another remediation for this. So basically, surgery is talking about or is looking for cure. So it's about curing your hearing. Well, hearing aids, it is a remediation in which these are electronic devices that are worn in or behind the ear. So they amplify sound to make it easier for individuals with hearing loss to hear and communicate. So modern hearing aids are often digital and can be customized to individual hearing needs. So basically, hearing aids are like headsets attached or AirPods attached to the ear, which the one that is affected or yeah. So it usually costs up to 60K to 100K. It depends on the quality and on the product also. So this is to amplify, to amplify the sounds to make to make it more easier for those with hearing impairment, make them easier for them to hear. Then we also have the treating infections or obstructions. So this is a treatment for those who have hearing impairment. So this treating infections or obstructions means that these are some types of hearing loss that are caused by infections like otitis media, or we also have the physical blockages, which is the impacted earwax, or medical treatment. We also have the antibiotics, antifungals, or minor procedures. We have the ear irrigation or surgery. Then this can restore normal hearing in such cases. So, but by this, they are treating some infections or obstructions in order to revive the hearing loss. Yeah. So next is we also have the educational and therapeutic interventions. So first, we have the speech therapy. So, speech therapy is to help individuals with hearing impairments develop or improve their speech and language skills. It often includes articulation training, voice therapy, and strategies to improve the listening and speaking. So, basically, speech therapy is a training for those with hearing impairments to practice and to train their voice articulation, speech articulation, and their listening and speaking skills. Then next, we also have under the educational therapeutic interventions, we have sign language education or the SLE. So this tackles about it helps individuals with hearing impairments to communicate effectively. It is especially crucial for those with profound hearing loss. It may also include teaching families and peers to foster inclusive education. So basically, if you talk about sign language education, it is a way of communication for those with hearing impairment. This specifies those who has profound or no sense of hearing at all. So they are required or inspired to communicate using the hands. Yes, the hands. So sign language is a communication style in which hands are the medium to communication. So for example, if we talk about, or if we're gonna talk about letter A in the alphabet, so A stands for this sign, while B stands for this sign, letter C stands for this sign, and letter D stands for this sign. So it's basically A, B, C, D, E. We also have the E sign. So that is for sign language. We also have many examples of sign languages. We have this means community, or family, and then this one is amen. So there are many sign language cues that is actually very helpful rather to those with hearing impairment loss. So actually, hearing or sign language is also very rampant today, and it is also practiced in schools, especially in teachers. So teachers actually attends or they have trainings and workshops for this in order for them to be skilled and to know sign language in order to teach students with hearing hearing impairments. But it's also not just teachers who needs to practice sign language, but we also have the community and the family also in order to support those with special needs. Next is we also have the auditory verbal therapy or the AVT. So it focuses on teaching individuals to use their residual hearing through the use of hearing aids or cochlear implants. So it emphasizes listening and spoken language development, often without relying on sign language. So auditory verbal therapy means it can be implemented by the use of hearing aids or cochlear implants. So it is independent from sign language. Then we also have the special education programs, which is tailored educational settings that cater specifically to the needs of students with hearing impairments. So these programs may include smaller class sizes, specialized teachers, and specific teaching strategies adapted for hearing impaired learners. We also have the use of assistive technology. So we have the FM systems, wireless systems that enhance the speaker's voice directly to the listener's hearing aid, reducing background noise. We also have the captioning. Subtitles for videos or live speech help individuals understand auditory content visually. Then we also have alerting devices, which means visual or vibrating alarms that signal doorbells, telephones, or fire alarms. So basically, assistive technology, their use or their purpose is to assist those hearing impaired learners. So that is all for the cure and remediation for hearing impairment disorder. Now, this time, also, we are going to tackle or to talk about the resolutions and support in school. So, by this, we're going to talk about what should the schools do in order to take action for this or for those with hearing impaired learners. Then, first, we have the inclusive education. So, inclusive education is one of the most vital and important things to implement or to consider in schools, because inclusive education is the practice of integrating students with hearing impairments into general education classrooms. So, the meaning of this is students with those special needs of hearing, they are given the chance to be part of those students normally, in order to make them feel included and also normal. Next, inclusive education also promotes equal learning opportunities and social interaction. So, since they are exposed to general education classrooms, they are also given the opportunity to equal learning and to socialize with other kids or learners as well. Then also we have inclusive education requires necessary accommodations such as interpreters, captioning, and adaptive technologies to ensure effective learning. So it is not just about implementing inclusive education, but it is also to assist and support inclusive education, in which the schools should provide necessary assistance or devices or even accommodations, facilities to support those with hearing impairment. That is for the inclusive education. Next, we have the individualized education plans or the IEP. So this is a legally mandated document for students with disabilities in many countries. Yeah. So for example, we have the IDEA in the US. So next, we also have the it outlines specific educational goals, services, accommodations, and assessments tailored to the students' unique needs. So this also focuses on providing what they can give to each or to the unique needs of the learners. And also it includes input from educators, parents, therapists, and the student when appropriate. So that is for individualized education plans. Next is we have the visual aids and subtitles. So visual aids, it basically means pictures, images, videos, like that, or something that is something that can be seen through the eyes. So these tools compensate for auditory barriers by providing visual representation of information. Yes. Then visual aids includes charts, diagrams, infographics, and sign language interpreters. So sign language is also an example of visual aids. Next is the subtitles or the captioning. So this is to enhance comprehension of multimedia content by displaying spoken language as a text. So actually, subtitles or captioning is very common. We can see this in the movies, yes, something like that. So these are under the visual aids and subtitles. Next, we have the classroom strategies. So sitting close to the teacher. So it improves visibility of facial cues and lip movements. It has a sound reception if using hearing devices. Yeah, so sitting close to the teacher also helps those with special needs to learn more and to understand more. We also have the using of microphones and sound systems. So this is also very important because it is beneficial for amplifying the teacher's voice directly to hearing aids via FM or Bluetooth systems. So using microphones and sound systems amplifies or improve the teacher's voice in order for those learners with special needs to make it easier for them to hear what is said by the teacher. Next is we have the written instructions. So provides clarity and reinforcement for verbal instructions, ensuring students don't miss important details. So written instructions that are detailed helps reinforce the students, or it reinforces clarity and verbal instructions. Next, we have the peer support and awareness campaign. So educating peers about hearing impairments reduces stigma and fosters an empathetic and inclusive education environment. So it is also said earlier or discussed earlier back in the cure and remediation that if we talk about sign language education, parents, the communities, and the peers are also inspired, or they are also asked to learn sign language as well. So that this can be connected to peer support and awareness campaigns. So in order for the peers, the families, and the communities to support those with hearing impairment needs, so they must show support, reducing stigma, and must foster empathetic, inclusive environment. Next, we have the activities that may include awareness sessions, simulations, or inclusion campaigns. So, not just in the school, but also in the community as well. That there could be seminars, campaigns and sessions that helps the community, the peers, the families, that in order for them to make action and support for those with hearing impairment or the hearing impaired learners. Next, we have the peer buddies or support groups can offer social and academic assistance. So, for example, in a classroom setting, peers can also help those with special needs in hearing. They can assist them for academic assistance. So they could assist them in answering modules, and they can help assisting them in listening, or even guiding them in understanding the instructions. So by this, they may feel more included and welcomed since they are assisted and supported by other peers and communities as well. So again, what are the top 5 resolutions and support in school that they could or they must make. So we have the inclusive education, which is definitely and technically implemented, both private and public. Next, we have the IEP, which is the individualized education plans. Next is the visual aids and subtitles. Then we also have the classroom strategies and the peer support and awareness campaigns. So, by this, if these are implemented thoroughly successfully, then students with special needs of hearing may feel welcomed and equal to those normal learners as well.
So now let's talk about the relevant laws from Philippines. So we have here the Republic Act 7277, the Magna Carta for Disabled Persons. So it is a Philippine law that ensures persons with disabilities have equal rights and access to education and among other services. So schools are required to create an inclusive environment by removing barriers and providing necessary support for learners with disability. So this law, no, it ensures they have equal opportunities in education, not just in education but also sa health services. No? Dapat na sila proper treatment even though na sila mga disabilities. So, for employment, so since they have the disabilities, still they are allowed to work in public services. So, the law promotes the full participation in society and requires both government and private sectors to provide necessary support for PW. Second law, the Republic Act 9442, or an act amending the Magna Carta for disabled persons. So this law strengthens RA 7277 by providing additional benefit and privilege to persons with disabilities or PWDs, such as discount on goods and services. It also prohibits ridicule and discrimination against PWDs in any form, especially in public places. For example, in school, a teacher avoids making jokes or negative remarks about a student's disability and promote respect and understanding among classmates by following the RA 9442. Third law, the Republic Act 10533, or Enhanced Basic Education Act of 2013. So this law improves the Philippine basic education system by implementing the K-12 curriculum. So which includes making education inclusive and learner-centered. So it ensures that the needs of all learners, including those with disabilities, are addressed through appropriate teaching strategies and materials. So, for example, in school, a teacher adapts learning materials into braille or large print for students with visual impairments and uses inclusive teaching methods to help all students learn effectively. Let's talk about the relevant global laws. First, we have the UN Convention on the Rights of Persons with Disabilities, or the CRPD. So this international agreement advocates equal opportunities and full participation of persons with disabilities in society, including the education. So it encourages inclusive systems that support diverse learning needs. For example, sa school, a student with disability joins regular classes with the help of support services. So, like a teaching aid or assistive technology to ensure they can learn alongside their peers. Second, we have the Individuals with Disabilities Education Act or IDEA US. So this US law ensures free appropriate public education or the FAPE for students with disabilities in the least restrictive environment. Second law, Individuals with Disabilities Education Act or the IDEA US. So this US law ensures free appropriate public education or the FAPE for students with disabilities in the least restrictive environment or the LRE. Second global law, we have the Individuals with Disabilities Education Act or the IDEA US. So this US law ensures free appropriate public education for students with disabilities in the least restrictive environment or the LRE. So, second global law, we have the Individuals with Disabilities Education Act or the IDEA. So this US law ensures free appropriate public education or the FAPE for students with disabilities in the least restrictive environment or the LRE. It requires schools to provide customized support through individualized education programs or the IAPS. For example, in school, a child with a speech delay receives regular classroom instructions along with scheduled sessions with a speech therapist as an outline in their IEP.
What teachers should do? First, early identification. Recognize signs like poor response to sounds. An example of this is when you're having a classroom attendance and the child complained that his name wasn't called even though you already did. And second sign second sign is unclear speech. Like for example, we were having an oral recitation and the child's voice wasn't or is not enough or is not clear. And third example is inattention. He can't focus on the discussion because of some hearing issues. Second, modify your teaching techniques. Speak clearly, use gestures, visual aids, and repeat the instruction. And provide written materials so that the child can see properly. Third, promote inclusive culture. Encourage your students to be respectful to the students who have special needs and prevent bullying. Work with a specialist. Collaborate with speed teachers, speech specialists, and audiologists, and ask for their advice. Fifth is be patient and encouraging. Boost their confidence, recognize their efforts, and give a regular feedback. Supported details and statistics. On 2024, the World Health Organization stated that over 1.5 billion people live with some degree of hearing loss globally. 80% of people with hearing loss live in low to middle income countries. Early detection or intervention before 6 months of age can improve language outcomes.